So good afternoon, everyone. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, and streaming on Facebook. I'd like to thank John Palsy in Connorsville and his staff at TV3 for airing the show today as well. And of course, if you have questions, you can ask them on WCTV's Facebook page, or you can tweet at WCTV Info. I'm Jason Troutwine, Vice Chancellor for External Affairs at Indiana University East, and it's a pleasure to be with you here today, and in place of Eric Marsh, who couldn't join us here this afternoon. Joining me in the studio are Dr. Tom Huth, the Vice President of Medical Affairs at Reed Health, and Dr. David Jetmore, the Wayne County Health Officer. Gentlemen, thanks for being here again today.
All right,
our pleasure.
Thanks for having us, Jason.
And we're going to do something different today. We're actually joined by Zoom by Tom Dickman. He's a community member who has had COVID, and he's going to come to us today and share a little bit of his experience and allow us to ask a few questions and then find out what it was like to have COVID. So if we can have Tom join us.
Can you hear us, Tom?
All right, we're working on the audio so audio is the theme of today, right?
Hello.
Hi, Tom. How are you doing? Okay, we're going to, actually, while we get that ramped up, we're going to go to Dr. Huth, and I know he's had an exciting week and a lot of things going on. So would you like to bring us up to speed on what's going on at Reed?
Yeah, sure. We continue to have really high volumes. I brought some data for that. We'll get into that here after a while or whenever it's appropriate. And we're in the sort of the final stages of getting ready for vaccine. It'll be distributed to certain high-risk groups, and Reed is responsible for deploying that here in the four-county area that's from Randolph, Wayne, Union, Fayette counties. So we're working out the details now of making that available as soon as the state gives the go-ahead. Probably will be something like December the 15th or 16th, possibly at the earliest, is the current best guesstimate, but the information on this changes almost by the hour. So anything we say now, we sort of have to take with large grains of salt. But one of these times, it's actually going to work when we say. But in addition to that, I had the exciting experience yesterday of working with a film crew from MSNBC, and really was a reporter from the NBC affiliate in Chicago came down, and a technical crew from Indianapolis came over and spent a good part of the day yesterday at Reed. They were doing stories at Reed and a couple of other places around the state to kind of highlight Indiana's place in the current surge in the COVID pandemic. We're a little bit overlooked. We're kind of in between some of the more or outside of the worst hotspot zone. Although this morning I noticed on the CDC's website that Indiana is number 9 out of the top 10 COVID hotspots at the moment. And so NBC was interested in doing some stories on hospital preparations and hospitals getting overloaded, and that's a very spotty thing even within the state of Indiana. But of course, we have been struggling with very high workloads for quite a while now, and we've been discussing that in various ways in the media, and it came to the attention of a producer who actually has local ties, and she contacted us on kind of the middle of the day Wednesday. Could she send a guy out? So we worked with that, and it was a fun experience, and I did a very short live interview with the anchors at MSNBC on the top of the news hour at 9 o'clock yesterday morning, and then they replayed that throughout the day. Then we did a lot of other filming and interviews, and we had including an interview with a recovered COVID patient to talk about her experience, and also they were interested in our preparations for the vaccine, because we've managed to get one of the ultra-low temperature freezers that are required for the Pfizer vaccine and installed that, and have been doing some planning and preparation around that, some simulations with it to make sure we know how we'll be able to process the vaccine from that. And they were interested in all of that. So it was a good experience, good crew, good reporter, really engaged young man from Chicago came to do that, and it was fun for me.
Well, actually, it's a great compliment, the fact that MSNBC wants to come talk to you, talk to the folks at Reed Health, to find out how you're handling the situation. So I would view that as a great compliment. Maybe not a compliment to our numbers as far as a state or a county, but I think maybe a compliment to the role that Reed has played in trying to help our community.
Yeah, I'm sure you're right. We've kind of bubbled up on radar scopes in different ways. I've done interviews for Dayton television stations, a couple of different Indianapolis TV stations. I've written an article for the Indiana Chamber of Commerce for their monthly magazine. We have this show. It really kind of started here, to be perfectly honest with you. And I wish Eric were here to kind of get the kudos on that, because he's the one who really thought this concept up. And we thought we'd do it once or twice, and we'd run out of things to talk about. But here we are. I think this is we're getting close to show 40. I'm pretty sure. And but I think as a result of all that, there's just been more recognition that we're out there. We've been putting information out, and then things clicked with this producer who's based in New York, but she has family in Fayette County. She actually a lot of family in Fayette County. Her father grew up there, and she actually visits there from time to time with her kids. And so she noticed the name and the location and thought, there's a connection, and we established that relationship. So maybe other things will come from it. I don't know. But what I told them was that I really appreciated their interest in, because anything that helps us kind of get the story out of what we're doing here locally will help us in actually managing the pandemic. That they may think of themselves as news people. They're in the news business to go around and gather news stories. But really we want to look at the relationship with them, as we do with WCTV and Eric and his team and others, as a partnership. That it's not just how to treat and plan, but it's how do we communicate on all the things that are of importance. And so I was glad to make that connection. And so it was fun. I don't know if anything like that will come up again. But I said to somebody, to the point you just made yesterday, I said, everybody's like, oh, this is awesome, great job, or, this is great for Reed. And I'm like, well, be careful what you wish for, because we also don't necessarily want to become known as that place that's a disaster area of a COVID, which we're not, but sometimes that's the message people would take away from something like that.
Sure. Yeah, that's the bittersweet part of it. While Reed has responded very positively to this, that means that we have something to respond to, and I think we all hope that we get to a place where we no longer have to respond to what's going on. And I think to your point about Fayette County, obviously our watchers on TV3 in Connersville, maybe they know who that connection is from Chicago and the media. And the media obviously they play a major role in trying to help communicate what needs to happen right now. You mentioned a second ago someone who had COVID, and I think we are ready to have Tom Dickman join us. Tom, can you hear us okay?
Yes, I can.
Wonderful. So thanks for being here with us and,
Sure.
and sharing your story. So tell us a little bit about when did you have COVID, and what was that experience like for you?
Well, my wife and I actually both came down with COVID back at the beginning of July. We picked it up from a friend who was asymptomatic, so he didn't have any symptoms, and he was exposed to it at one of the workplaces here in town. And so we picked it up from him, and I'm not quite sure. I was with him on a Tuesday and then on a Thursday. And the reason I say that is because I got it 2 days before my wife did. And she was with this person on Thursday. So, and again, I was with him Tuesday and Thursday, so I don't know whether I got it from him on Tuesday and then she got it from him on Thursday, but hers hit her 2 days after mine. We both had the very same symptoms. We had sore throats, and we had a temperature of 100.3 for 2 days. And after 2 days, it was gone. Now, my wife had one night she had chills and was shivering some with hers, which I did not have. But my third day, I was out running on the street, and one of my neighbors saw me and said, "I thought you had the virus. What are you doing out here running?" And I said, "Well, the symptoms are all gone. I'm still staying away from everybody." And we kept our distance when they stopped me when I was running. But I think because I'm in good health, the symptoms were mild for me. Even though I'm a senior citizen, I'm young at heart. So luckily for me, our symptoms were mild.
Yeah, I'm interested. It's an interesting thing. We were talking about this a little bit before the show, even that everyone's symptoms, they can be very different. We all have heard of folks who have been hospitalized, and fortunately for you, Tom, and your wife, you didn't experience that. Have you seemed to have any after effects? I mean, anything that's been lingering for you?
No, neither one of us have any after effects, thank goodness. We're still playing pickleball and getting our exercise, doing our social distancing and wearing our mask and stuff. So as of right now, we've not noticed any side effects. I had a physical actually a month ago for my annual physical, and everything turned out fine. My blood pressure is 120/80, which is pretty good for my age. And so basically health-wise, I'm fine.
Dr. Jetmore, I'm curious, just in some of the stories that you've heard and some of the folks that you've encountered, is it typical what Tom experienced, or do you think it's all over the place? What would you suggest?
Well, I think there's an incredibly wide spectrum of symptoms that people experience, all the way from, on one end, having no symptoms at all, but having the infection and spreading it among others, which is what Tom's contact did, all the way to death. Some people may get a headache and a mild cough that lasts a few days. Others may have much more severe symptoms that include shortness of breath. They may need to go to the hospital and in an intensive care unit and have assistance with their ventilation. The other thing that's paradoxical about this, I think there's a lot about this disease we don't know and that we're still discovering kind of on the go here, and a lot that won't be known until maybe after the pandemic's over and we look back on this. But we see people who are in great health. They might be a marathon runner and have a blood pressure of 110/80 and be able to whip their weight in wildcats, so to speak, and these people die. And then we'll see a frail 99-year-old who is sick for a week and survives. So there's more to this than just physical health, although we know that people with obesity, diabetes, hypertension, they're much more likely, and of course age, they're much more likely to have a less than good outcome with the disease.
Yeah, Tom mentioned that they trace it back to a friend who was asymptomatic, and of course, that's the problem with this disease. There are so many people who don't have many symptoms but can spread it to others for a fairly long period of time. And so the problem is they can be a risk to people who are much more vulnerable. Tom, fortunately, didn't have many effects from that, which is great. Glad to hear that. But if his friend never found out that he had the disease and Tom just thought he had a cold, got over it a couple days and went back to his normal activities without being tested, he could have been a risk to others. Sounds like, Tom, that you did all the right things, so proud of you for that. I'm just wondering a couple questions about your experience. How did it come up? If your friend was asymptomatic, how did he find out that he was positive, and how did that get to you being tested?
Where he works at, they sent everybody home because somebody there tested positive. So he had to go home, and then he had to go be tested. So when he finally got in to get his test and got his results back, he found out that he was positive, even though he had no symptoms at all. And unfortunately, before he got his test back, we had contact, or we were within a few feet of each other or whatever. And so we picked up, I guess, the virus from him. And then another thing I want to comment too is, we are just anticipating that's where it came from. That's the thing about this virus. You don't know where you're really getting it from necessarily. We're assuming this is where we got it, but I could have picked it up getting gas at a gas station or something. You don't know for sure. But we just know that this person tested positive, and before he could go back to work, he had to be tested again and have, I think, 2 negatives before they would allow him to go back to work. And then after we quarantined, we called back into the Elder Bierman site where we had our tests done, and to see about going back in and being tested again to make sure we were negative. And they told us no, they didn't want us to do that, that they're covered up. They want us to just stay quarantined. They told us 10 days after the fever dropped, and to just stay at home for 10 days, which we did. And then after 10 days, then we started going back out then.
Okay. Yeah, back in those days, we had slightly different standards for all the quarantine and so forth. And in your case, it would have been isolation because you had active disease, but we had slightly different standards for all that back in July. So those people who are listening should realize that if this happened today, it would not be handled exactly the same way you're describing. It would be close to it, but not exactly.
So what would the differences be, Dr. Hughes?
Well, even then, we were starting to not do follow-up tests. Prior to that, there was a lot of retesting being done to go back into certain situations like school or work. But what we've since found out is that on the standard PCR nasal swab test or nasopharyngeal swab test, that can actually remain positive a really long time, even if you're not actually infectious. And so, we don't want to, we've really stopped basing return to work decisions and that kind of thing on the swab test because it can be misleading and keep people out of work much longer than they really should. And I always go back to the example very early on. There was a jail deputy from Union County who had COVID-19, and back in those days we didn't understand these things, and so the sheriff was very reluctant, didn't want him back in the building on the job until he tested negative, which he continued to test positive for 2.5 months. And so that's the kind of havoc it can wreak if you make decisions on the PCR testing. So we don't do that anymore. It's really just pretty much strictly time-based, although now, just in the last few days, really, the CDC has changed its recommendations on that to make the time frame a little narrower. That can involve a test. If it's negative on day 5, you can come out on day 7 if you're a quarantine. Not when you're active disease, though. That's still a 10-day isolation regardless. So there are some changes being made to all this over time. But Tom, I wanted to ask you about how did you even know that to worry about yourself as far as testing? Is it because you had symptoms and you knew he had been positive, so you took the initiative, or were you contacted as a part of contact tracing by like the health department, or how did it come to your attention that this should be an issue for you?
The person called me, actually texted me Friday morning after I was with them that Thursday night and said, hey, I just got my test results back and they're positive.
Okay.
And we did not know anything about this testing even being done. So it was after the fact then we found out they were tested, just hadn't had their results back, and that they came out positive. Well, Thursday or Friday morning when I woke up, I started having a sore throat. And as the day progressed on Friday, my throat just kept getting sore. And I told my wife, I said, I think I got the virus, because I said, I'm never sick. And my throat was just like on fire. It was getting real sore. And so Friday night, we called the Elder Behrman site and said, how late are you open? And they said until 8. So at 7 o'clock, we went in Friday night and had the test done. And I got the results back the following Monday. And so it came back positive.
So did you, from that point on, have interaction with the health department over contact tracing? Just wondering if you did, what that experience was like.
I did not have any contact with anybody locally. Someone from Indianapolis did call my cell phone and left a voicemail wanting me to call back in to talk to them about where I contacted it or where I received it from. Well, I already knew kind of where I thought I got it from and everything. And then they called my wife's phone too. She was a good Samaritan, and she called back and talked to them. And I never did call back in. I should have, but I did not.
Well, shame on you. You should have, because they not only want to kind of trace you backwards, they want to trace you forwards to know who else might be a contact of yours. But it sounds like your wife kind of took care of that, so it's all fine. So
Right.
I also wanted to ask you whether you had the symptom that we talk about all the time as kind of being the the symptoms you're describing so far, the sore throat and all that. That's very kind of generic. A lot of things can do that. But the one thing with this virus that we consider to be kind of really the high alert item is disturbances of taste and smell. Did you have any of that?
Friday afternoon, I said to my wife, I said, where's your cinnamon at? I want to see if I can smell the cinnamon in your cinnamon container. So we got the cinnamon out, and I could not smell the cinnamon. So we thought too, okay, I definitely have this because I'm not smelling anything.
Okay. And last thing I wanted to ask you about, now that you're a recovered COVID patient, have you, A, had the antibody test to see if you have antibodies, and B, have you considered or looked into becoming a convalescent plasma donor?
No, I've not had any tests done. I would like to know if I have it, but I don't know. I guess I could go donate blood and find out that way possibly, but I've not had any opportunity to do that at this point. But yes, I would be a plasma donor if they need that.
Well, for you, your benefit, and anybody else who is in the same position who wants to know, you can actually call up Reed's central scheduling and schedule your own antibody test. Does not require a doctor's order. And I think we keep the cost pretty low. In fact, a lot of insurance is required to cover it. So you could do that easily if you just want to know. But the other thing that to consider for somebody who's a recovered COVID patient is to help the next guy with COVID-19 by becoming a convalescent plasma donor. And we are doing plasma donations at Reed now. We do them when we have our blood drives, and also they come in and do special plasma donations so that the Community Blood Center in Dayton takes and processes it. Excuse me, but they will bring plasma out here to treat our COVID-19 patients who meet the clinical criteria to be treated with that. And so we're always looking for donors, and you should consider doing that. And anybody else who's watching who is like you, Tom, should think about it too.
A question I might have for you two doctors would be, is there any study done that certain blood types are more susceptible of getting the virus than others? Because myself, I'm A positive blood type.
Yeah, there's one study that shows, suggests fairly strongly that if you have type O, you're going to do better with the virus than the other blood types. So it would be interesting to ask your friend who is asymptomatic what his blood type was, Tom.
Okay.
I mean, that's kind of a little anecdotal thing, but this is, one of the things that this is a mosaic. I'm sure that this disease there are many pieces to this puzzle. This is a tiny little piece this blood type evidence, but your suspicions are correct. It has been shown to have an effect.
Tom, were there others that you're aware of who your friend may have been in contact with who also contacted the disease?
Yes, there was 7 of us all together. This was now back before you were supposed to be limiting your spacing as much and all that stuff and crowds and things. And there were 7 of us, and 5 of the 7 did get the virus.
I think that speaks to how contagious it is, and how, obviously not at the fault of the individual. I mean, it was early in all of this when some of these things weren't put out there, but how quickly it can spread, and how one person can affect several other people all at one time. So we really do.
We were outside. It was an outside restaurant that we were at. So, we're thinking, okay, we're outside, fresh air and everything that should help, protect all of us. And we were spaced a little bit. And but it shows, again, like you just said, how contagious this can be.
Yeah. Well, we really appreciate you coming on this afternoon and sharing your story and giving us some more things to talk about, and also for other folks in the community to have one example of what it was like to have COVID. And I think something that we may be doing moving forward is to bring a few other folks that maybe had a contrasting experience, maybe a little bit, maybe where they had some other kinds of, maybe where they were hospitalized or something like that, some other types of effects. But thanks for coming on today. We appreciate your time, Tom. Glad you're doing okay. Glad your wife's doing okay. And glad you're out running again, right?
That's right.
Playing pickleball.
Great, thank you.
All right, thanks again. All right, so I want to actually turn to Dr. Jetmore just for a second. And I know Dr. Huth had a chance to talk about his exciting week, so has yours been equally exciting?
Well, every week Eric sits in that chair and turns to me and says, "What's new in Wayne County, Dr. Jetmore?" And I wish I could just, do a cartwheel across the studio here and pump my fist skyward and say, things are great. But our positivity rate is, we're testing 200 or 300 people a day. And of these 200 or 300 people, we're finding about 70 positive cases. Our positivity rate is 11.7%. We're at the orange level in the state. We're at 2, down from 2.5, so which would kick us into the red level. But our death rate is at, I think I looked this morning on the state map that it was listed as 93, but I know for a fact it's 98, and there's 5 deaths pending to be examined if COVID was the cause of the death, and they probably all were, so we're probably at 103 deaths. So that's how my week was, Jason.
Yeah, I wouldn't necessarily call it exciting.
No, it wasn't.
I would say
it was disheartening, especially when you realize that we're at kind of high tide and the hurricane's coming. I mean, I think many people are fearful that the worst is ahead of us. I hope, and what's really frustrating is the fact that we have the power to control this viral force here by simply social distancing and wearing masks. One bright spot is, the governor had a mandate that everyone wear a mask indoors. And a mandate means you're supposed to do that. And it's not an invitation, or if the mood hits you, put on a mask. So Mayor Snow is providing money and 4 people to enforce this mask mandate which will start as soon as we get these people hired and trained. And they'll go from business to business, and if the businesses aren't wearing masks or asking masks to be worn, they'll be given a written warning. And if they still don't comply, they'll have to shut their business down for 24 hours, the third time for 48 hours, the fourth time for 5 days, and the fifth time for the duration of the pandemic. Now, having said that, the last thing I want to do is to shut down a business. That's a catastrophe for everybody, for the business, for the people working there, for the people, the patrons that patronize that business. And I'm hopeful it's like your kids misbehaving and you raise your finger up. You know, you don't want to go over there. You just want to raise your finger up. And I hope this will act as a raised finger, because that's a dire punishment. I mean, I think that's worse than a fine, is having your business shut down. So, but we've been forced to do this because we've had businesses that have just been defiant. I mean, they've told us that they're not wearing masks, they're not enforcing masks, and they never will. So we've had to take a more proactive approach to deal with this problem. And we're doing this to protect the safety of everyone, and with our numbers rising.
Right. Well, it's, you know, it gives a little bit of teeth to that, and it also, well, hopefully, I mean, a business, you know, they can be compliant by simply wearing the masks. I mean, it's that simple, right? To avoid any kind of shutdown that may be placed upon them. But the last thing that I think that, from my perspective, if I were a business owner, the last thing I would want would be forced to shut my business down because I don't have employees, because they're all in the hospital. And that's where they could land. We saw how quickly from Tom Dickman, just one person, you know, 7 people. And that's, I think, you know, that could really be detrimental to a business, and the way around that is wear a mask.
Yeah, and that's a good point. I mean, if we get these numbers down, if we get this positivity rate down, our death rate down, it's going to help businesses. It's going to help businesses stay open, because it's going to remove the need. And we're seeing this across the country from mayors and from governors that are having to shut businesses down through curfews or just the entire business, depending on the nature of the business, in order to protect the public health. And we want to not do that. We want to stop this before it gets to that point, before we're forced to do something.
Yeah, that's a great point. I know we have a couple of questions, so if we can maybe get to one of the questions from Facebook. So this says, are you seeing the same amount of flu as last year? And if not, do you believe that masking is helping with that? So Dr. Huth, you want to take that one?
We do keep track of flu. We report flu testing that's done in our organization, so we're not really necessarily representative of the area. And it's not reportable to the health department the same way that COVID-19 is, so you have to understand there are a couple of key differences. But in general, we're not seeing a lot of flu yet. I would love to say it's because we're masking, and I think there is some evidence that in the Southern Hemisphere, for their winter that ended, you know, in September, there was some thought that there were low flu rates in, like, South America and such, and Australia, and that it might have been due to increased masking and distancing, and that makes sense. But I don't know what will happen this year. The only thing I can say about influenza is that when we have the influx of influenza is highly variable from year to year. Sometimes it's earlier, like we can see upticks in flu in October and November, but sometimes, and to peak at around Christmas time or the end of the year, or it can all start later. So we will only know if we had lower flu rates, and some analysis can be done of why that was. You know, you have to factor in how much did COVID-19 and all our harping on getting influenza shots encourage a lot more people to get influenza shots. That could certainly have an effect as well. So, and there will be a combination of factors. But I am hopeful that when comes spring or summer, when the state and federal authorities have had a chance to analyze all this, they'll come back with the same thought process that's been applied to the Southern Hemisphere, that masking and distancing may have had an impact. You would expect it would.
Yeah.
But I can't say that it has now.
I mean, it's an interesting question.
Well,
maybe
I don't see
hygiene too, correct?
what.
Personal hygiene, just washing our hands and using hand
yeah.
sanitizer, maybe.
Personal hygiene, social distancing, mask wearing. I think you alluded to this, Tom. It's kind of intuitive that any respiratory droplet-borne disease is going to decrease. And it's anecdotal, but I haven't had a cold since January, and I always have 2 or 3 colds. So that's not the makings of a scientific paper, I'll grant you that. But I don't see colds among others either. Maybe we could call the Kleenex people and see if their sales have dropped.
Yeah, this sounds like a great research project for someone, doesn't it? Yeah.
It hasn't helped very much with my allergy symptoms, which is very disappointing to me.
Well, even when you wear the mask?
Yeah.
Well, that is disappointing. I'm disappointed for you.
Yeah, special filters for that too, right? I'm curious, just as a follow-up to that question, at the hospital, have you encountered a few folks who have had both the COVID and the flu?
We've had 3 cases
Okay.
of both influenza and COVID, all wound up in the hospital. Consequently, we're commonly now testing both for influenza and COVID at the same time in somebody who's actively sick and sick enough to warrant consideration of hospitalization. We do both.
Okay. I think we have another question, actually, so if we want to go ahead and prompt that up. So where does restaurant capacity stand currently? I only ask about restaurant capacity because driving past some just seems like a lot, or too many are there. And also, how are each of our county schools doing? So maybe we can take the restaurant question first and then get into the school conversation.
Well, the restaurants are asked to keep their patients socially distanced and wearing masks if they're not eating. The level orange of our county, when you're at that level, you can't have more than 50 people socially gather, but this doesn't cover businesses. This is for you and your family deciding to get together for a birthday or a wedding, so these have to be limited to 15. If we went to red, they'd be limited to 25. But the restaurants, if the restaurant's big, they can have more people.
Are bars able to be open right now, or is it just the restaurants? I'm not sure.
I think bars and restaurants both can be open.
Okay, so they fall under the same guideline.
Mm-hmm.
Okay. Yeah. And then as far as the question about the schools, so any information on how the schools are doing right now? Are they able to keep do we see still? I know early on we saw that the schools really wasn't a place where there was a lot of where COVID wasn't being transmitted. It wasn't a lot of spread. Is that still the case?
Yes, and it's a reason to keep the schools open. We're seeing very little spread within the confines of that school. These kids are wearing their masks, they're socially distancing, and it's a controlled environment. We're seeing if we do have a case in the school, it's being brought in from outside where the child was doing something outside of school. And most of the kids that have been kept out of school have been children who were contacts with a child who had COVID. So I'm so proud of our schools here in Wayne County. They've done an incredible job. I think it's tough being a school teacher in normal times. And they've soldiered on and done well, and they want to continue to do this. I know in other communities, what did I say our rate was? 11.7% positivity. When they got to 3% in New York, de Blasio shut the schools down. But interestingly enough, he didn't shut down bars or restaurants. These children shouldn't be punished because of doing something right. And it's such a important part of our social fabric, the schools. A lot of these children depend on the schools for their meals and socialization, and in-house learning is so much better than these children in front of a computer. And that brings up another factor. If you've got a mother who's raising these children and she's working, she has to stay home and can't work and earn money. So that's a catastrophe there. So I am a big proponent of keeping the schools open. I don't think it should be dealt with by looking at the overall positivity rate, of which the schools have very little to do with. If we shut the schools down, it's not going to have any effect on COVID. If that changed, I mean, if we saw a lot of spreading within the school, then we'd have to look at this question again. But right now, I feel very good about the fact that our schools are open and our kids are learning, because I think it's going to be tough on these children when we look back on what's happened during this year.
I mean, you could probably make the case, couldn't you, that sending kids home from school might actually have the opposite impact on your community transmission rates, because, you know, if you're worried about kids spreading to each other at school, if you send them home, are they all going to sit at home separate from each other? Or, you know,
Did you do that when you were a kid?
Heck no.
No, you got on your bicycle and went somewhere.
Absolutely. Now today they may all come together and play video games in the same room versus the bikes. But they're probably going to have more likelihood of being together, being unmasked, being in social because that's where we're seeing it, right? We're seeing the social settings, whether it be family or when they're getting together at parties or getting together after school on their own time in their own way. That's where, and it's really been more with adults, from what I've heard as well, where, you know, the workplace, for example, where Tom was talking about his close contact received it. That's more of the case versus the schools where they're going through the protocols that they're supposed to go through.
Exactly.
Right.
Yeah. So I think we actually have one more question. So if someone gets the vaccine, will they still have to mask and social distance?
That's a good question, and I'm getting that question a lot at the hospital, because we're getting ready to vaccinate the highest risk healthcare workers here, hopefully in the next couple of weeks. The short answer is we don't know. The longer answer is I don't think anything will change. I think we will continue to mask until such time as the state and federal public health authorities recommend that they not mask. I think there are a lot of reasons to continue to mask and distance, even after I get and Dr. Jetmore, we get the vaccine, which we intend to do in a public way when that's available. Part of it is the vaccines, while very good, very effective, aren't going to be 100%. So, you know, we could still be susceptible and potentially be a transmission risk to others, even at a much reduced rate, but it's still there. In addition to that, you know, if I meet you at the grocery store, Jason, and I'm not wearing my mask and stuff, how do you know I'm doing that because I've been vaccinated, I'm immune, or am I just being, you know, rebellious and deciding not to play along? So as far as messaging others that I'm safe to be around, I intend to continue to wear mask and distance and do whatever the public health authorities recommend.
Yeah, I think you're going to cause anxiety if you go into a crowded store and you don't have a mask on. And the other thing, Jason, is the fact that when they did these clinical studies, Pfizer, Moderna, AstraZeneca, all of them, their endpoint was somebody gets sick, clinically ill. And obviously it mostly happened in the placebo group, but it doesn't tell us if people contracted the disease and were asymptomatic, or if they, and that's a good thing. It's a good thing not to have symptoms and be sick, but we never did, the trial wasn't designed to see if somebody contracted the virus and was spreading around. Those questions are yet to be answered. My feeling is once you get the vaccine, you're not going to get the disease, you're not going to get the virus, and you're not going to spread it. But that's still a question that needs to be answered.
And I think Dr. Hughes' point too, I'm thinking about the mayor's, the new policy that you were talking about as far as with businesses and whether or not they should wear masks and enforcing a rule that they wear masks. If all of a sudden we're in a place where some people don't have to wear a mask because they've received the vaccine, and then other people still have to wear a mask, and then it really becomes something very difficult to police unless we somehow all have a sticker that says I've got the vaccine and you don't, which I'm not sure we're going to want to do. So I think it's going to be really hard until we get to a place where it's all universal, which hopefully that happens. So what does the rollout look like? I know you talked a little bit about December 15th being the initial. So from there, what's the rollout look like?
This, what's being called Phase 1A, which is concentrated on healthcare workers at the highest risk, is expected to last through January. And partly that's because it's going to take a little bit longer for the vaccine supplies to build up the way than what they were initially expecting. The next phase will be concentrated on people in the community who are particularly vulnerable, the elderly, people with chronic conditions, and so forth. Then at some point down the road, probably more like next spring at the earliest, probably more like next summer, there'll be vaccine availability to everybody. But we won't be able to make it mandatory for anybody to take it, and there are going to be a lot of people deciding not to do that, that's the way it has to work because of this is a very unusual situation. People get to make their own choices, but I think what that means is we're going to actually kind of have a longer experience with the pandemic as a result than we would otherwise like to have.
Dr. Huth, I know you always come prepared with some slides to share with us. So I don't know if you would like to maybe have a moment we'll give Ryan a chance to pull those up, but take us through what's going on a little bit in your world.
Yeah. These are the Wayne County data. I just do a little graphing of the numbers that Christine Stinson provides. The last bar on the right is the current week in progress, and you can see that we recently have had a high point. Last week was a little bit lower than the week before. This week in progress, that will end on Saturday, so far we've had about, in Wayne County, around 300 cases. And I added a little star there for if we continue at the current rate, that's about where the week should end up. I hope that will be the case. That would be a second week in a row of a decline, which would be very welcome. But there's a couple of caveats in there. One is, I don't know what the rest of the week's going to look like. There could be a big explosion of cases, and that will affect the numbers. And everybody's expecting there to be a big surge post-Thanksgiving, so we don't want to read too much into what's happening last week or this week. It's really more about what happens next week and the week after. And then the next slide there, Ryan and Stephen, is one that I've shown before. It's the age breakdowns, and there's a lot of bars there, but I always show this to remind people that in the 70 to 79 and 80 plus age groups, in the last couple of months we've had a large increase in their proportion. And since we've had a little over 2,300 cases since the 1st of October, 19% of those are over age 70, and when we factor in what we know about the estimates of case fatality rates, we can actually calculate what we should expect in deaths from what we've seen so far. And that's the next slide. So there were 15 deaths in Wayne County for the entire pandemic up to October 1st, which was 7 months. And then since October 1st, again, out of 2,300 known positives, 19% were over age 70, with an average case fatality rate of about 19%. What we should have is around 104 deaths on the number of cases we've had so far, and we were up to 78 actually, with Dr. Jetmore saying that there are 5 others out there.
Probably 10. Five for sure and 5 pending. So that would bring us to 88.
We'll actually be at something like 83 to 88 deaths so far. So we're, I hope that my estimates are always overestimates, which means we'll be coming in under that. But unfortunately, the the predictions seem to come true. Last one is the Read average daily volumes, and that's just the last 13 weeks. And the last bars on the right are this current week in progress. You can see that we've had a steady increase in the total numbers of cases in isolation. That is the tall blue bar. The red middle bar is known positives in the hospital, and there are a lot of people who we think have COVID-19 or might have that haven't come back positive yet, or there are various things that happen there, but we're averaging about 60 a day known positives in the hospital. Fortunately, only about 5 to 6 on ventilators, which is good that that's not increased to the same extent. But Read is running now about 95%, 90 to 95% utilization of our entire capacity, and that's even factoring in that we've added 51 temporary beds in spaces that are not used to take care of acute patients. And those that's the temporary space is about half full, and the permanent beds are running about 95% capacity. So we've been doing that consistently for 5 to 6 weeks, and it's a little bit like running your car, your car into the red zone in terms of the engine speed. You can do that for very short periods of time, and it doesn't harm the engine. But if that's all you do is run it past the red line, your engine doesn't last very long. And that's the problem we'll have at Read in terms of effect on staff with burnout and such like.
Yeah, we all know. I mean, healthcare is a tough industry anyway when it comes to burnout. It's dealing with life and death issues every day, and then to add on top of a pandemic and the kind of census numbers you guys are having, and then also the pressures of just how they protect themselves, protect their patients. I'm sure I can't imagine what you all are going through, and we appreciate all that you all are doing, and Dr. Jetmore, you all too. It's just I don't get to see you two very often, so my gratitude goes to both of you and your respective teams. I think we have one more question that we'd like to get to before we get to the end of the program. So how are local nursing facilities with an alarming number of positive employees still allowed to work with residents?
Well, it's alarmingly, disconcertingly, and unfortunately true that a lot of nursing facilities, long-term care facilities, assisted living facilities around the state, more than half in the whole state, are currently having outbreaks. And that just falls along with correlates highly with the rate of community spread, the increases in community spread. So the question is, what do they do with positive staff? Because staff certainly become positive in that environment, or actually maybe the ones who are causing the outbreaks amongst the residents. That's a different set of blaming we can do. But what do you do with staff? The reality is they obviously should not be working with the patients who are not sick with COVID-19 at all. But at the same time, you can't clear out your building of staff because you need people to take care of the other residents who are there, whether they're sick with COVID-19 or not. So these guidelines make an allowance that staff who are positive but having minimal or no symptoms, which is pretty common, may work with the patients who have COVID-19. You can see how that should be perfectly safe. And so that is the current standard. And, but they should not be working with people around people who are not themselves positive. So if they don't have those kinds of opportunities to work in like their red zone areas, then they should be going home.
Okay. All right. And I think we have one more question, possibly. So we are 7 to 8 days away from Thanksgiving. I think this may get back to what you just talked about a couple minutes ago, Dr. Hughes. Should we, or are we seeing results from that, from the recent holiday where everyone gathered together?
Yeah, any time now. I mean, that we're a week out, which is maybe a little bit early, but we could be starting to see some uptick from that now. We have to factor in that the virus has a pretty long incubation time. So, I think next week we'll kind of begin to tell the tale mostly.
And then after that, there'll be kick up in the death rate.
Right.
2 weeks following that peak.
Yeah, which is, it's a sad reality of what's going on, right?
Mm-hmm.
Yeah. We have about 2 or 3 minutes left, and so Dr. Jetmore, I don't know if there's anything else you'd like to, I don't know if it's one last plea for masks or if there's anything else you'd like to share.
I think people, if you haven't heard that, you've probably been living on another planet for the past year, but it bears repeating. We need to wear masks, be socially responsible, distance ourselves from others. Hand hygiene is important. If we do this, we can defeat this virus. It's a simple thing. Is it a pain in the rear end to do? Yeah. It's something you have to think about. I'm sure you've all been halfway to the store and then walked back to the car to get your mask because you remembered that you need to have that face mask. Do you get tired of wearing it? Sure you do. But you know, if I can wear that face mask and help keep a business open or spare somebody from going through that disease or dying, I'm going to do it. And I encourage my fellow citizens to do the same.
Yeah.
Well, same thing. You know, I've been trying to send a message that maybe we should look at this from a little bit different angle, which is, you know, it has fallen to our generation to deal with the pandemic of the last century. You know, just like our parents and grandparents were the greatest generation that dealt with the Depression and the Second World War, and the generation before them dealt with the Spanish flu epidemic and First World War prior to them. This is our generation's time of testing, and you know, so we're kind of blessed to have this opportunity, honestly. But it requires all of us to stand up and do the right thing, not just Dr. Jetmore and me exhorting people, but everybody has to make up their minds to play the role that they've been destined to play for good, and that means doing some simple things to protect yourself and each other.
Yeah, I think part of that can be also making sure that you go out and get tested. We have three sites here in town, and you can go out and make sure that you go to one of those sites, whether it's at the old Elder Beerman or it's the facility in Cambridge City. Of course, we have the health department. There are other places where they can go to be tested. Encourage people to do that. Even if you're not feeling symptoms, go ahead and go out and get a test. So today I'd like to thank each one of you for being here today. Thank you, Dr. Jetmore. Thank you, Dr. Huth.
Pleasure.
And we hope everyone has a nice, healthy afternoon and rest of your week. So thanks again for being here.